This is a video of fetal intrauterine death at 28 weeks. This is fetal head. The submerged fetal head bones called Spalding sign is clear in this view. Spalding sign means the collapse of fetal skull bones. We can measure biparietal diameter and head circumference. Let's go to fetal cardiac activity. No cardiac activity is appreciated. This is fetal femur. To assess exact fetal age, because BPD biparietal diameter cannot measure fetal age correctly as the skull bones are collapsed and submerged. Fetal amniotic fluid liquor pocket and placenta can be seen. Placenta is on posterior wall. This is fetal thorax, fetal chest, and fetal heart is silent. There is no cardiac activity and no fetal movement noted. Let's see fetal heart from another view. The same result, no fetal movement, fetal cardiac activity not seen. This is the case of intrauterine fetal death. The femur of fetus measurement shows 28 weeks and fetal BPD biparietal diameter shows the fetal gestational age of 23 weeks. Because the bones are collapsed, so BPD shows the difference of 5 weeks from fetal femur. These are measurements of fetal BPD and fetal femur length. The measurement also shows gestational ages. Fetal position is normal cephalic and fetal lie is longitudinal. No oblique, no transverse. There is mild oligohydramnios